Hi, welcome to our blog. This is Rich Newsom. I want to talk this week about a crisis in care. You know, brain-and-spinal-cord.org is really devoted to brain and spinal cord injury survivors and their families, and we have seen something happen during literally the last couple of months that causes me to believe that there is a real crisis in the system that we really need to have Congress and the administration, the Obama administration, take a look at while they're looking at this healthcare situation. I'll give you the scenario. We had a client come to us, middle-class family. The guy was in a horrible accident and he was paralyzed from the neck down. This happens so many times that when there's a new catastrophic injury survivor, the family doesn't know what to do. They don't know what insurance they have. They don't know what their care options are. He ended up in a hospital that was a publicly owned hospital, and it was a middle-class family, a small business owner. He had a carpet company, and he burned through all of his available health care insurance literally within the first 30 days. 30 days. And what a lot of families don't realize is that there are caps on their health insurance for catastrophic care. I think they had, I don't know, $1 million cap. And when a family suffers, and a lot of the folks I'm sure watching this know because they've had loved ones or they themselves have been in this situation, when you have a catastrophic brain injury or a catastrophic spinal cord injury, the medical expenses go through the roof. Everything from, in this family situation, for example, this guy was on a ventilator, he was in intensive care, he required round-the-clock nursing care, and of course the costs of that just go through the roof. And so here was this family thrust into this unimaginable situation for the first time, and all of a sudden they're being told, oh, by the way, you're out of money. You need to take your husband and your father, you need to take him home. And it was just incredible to me. We got involved because they had a potential liability case, and we were trying to find out answers to, wait a minute, how could this be happening? Why, for example, isn't Medicaid picking up the tab? Well, comes to find out, the family had a few assets. They had a house, they had a few cars, they had a small business that was literally, it was almost a paycheck-to-paycheck situation, and the hospital wanted to make this family take him home. And there were actually even veiled threats that the legal department for this hospital started to make, that they were going to go appoint themselves as the guardian for this guy and ask the court basically to allow them to take him out of the hospital and almost drop him off at his doorstep. Now that didn't happen. We ended up finding a facility in South Florida called the Florida Institute of Neurological Rehabilitation, or FINER for short. Great facility for this family. They were able to take him on what's called a letter of protection. In other words, on the hope that they'll get paid if their case is successful against the guy that caused this. But what this showed is that there is a true, what I'd call a donut hole almost, if you will, in the healthcare system for middle-class families that do not have adequate health insurance for these catastrophic injuries. Because unless you've got 10 million plus of health insurance, you're going to run out. If one of your family members or Lord forbid you yourself have a catastrophic brain or spinal cord injury, you are going to most likely run out of coverage. So at that point, you're going to be faced with the situation of Medicaid, which requires you to basically drain all of your assets and either sell them or give them away so that you are literally at the poverty level to be able to qualify for Medicaid. And so absent being independently wealthy or absent being at the poverty level, most middle-class families do not have enough health insurance to cover them in a catastrophic situation. And it is a very, very bad situation. The hospitals are in a bad position because, of course, they're left with holding the tab for these patients who they can't push out the door or who they don't want to push out the door. And, of course, here are these families who are thrust into this unimaginable situation for the first time, having to deal with a money issue when what they really need to be doing is worrying about taking care of their loved one and getting the very best care that they can. So that's the blog, video blog this week. We wanted to sort of bring this to folks' attention, get the word out, and that maybe if someone sees this and thinks about it, reach out to your congressman, reach out to your senator, tell them that, hey, gosh, you're concerned about this crisis in care for catastrophic injury victims who are middle-class families, and that while we're considering health care at the national level, we need to do something for these families. We need to make sure that whatever the government ends up doing, that there is some consideration for the middle-class Americans who right now don't have enough coverage for catastrophic care. So thank you. Thank you for watching our video blog. If you got any questions, contact us or leave a comment on our blog site, and come see us again soon. Thank you very much. I'm Rich Newsom for BrainandSpinalCord.org.